Hello, this is Dr. David Green, CEO of the Nevada Pain Network, where we bring you anything and everything educational for pain management. Today the topic is, what are the best treatment options for spinal stenosis? First of all, what exactly is spinal stenosis? Well, it is a narrowing of the spinal canal where nerve roots are pinched as a result of bony and soft tissue overgrowth from arthritis. And it typically occurs with age as patients get over the age of 50, and usually it's at multiple levels and it is not symmetric. So here what you can see is this is a shot from the side. Here's the vertebrae, the discs, the spinal canal. Here's the spinal cord coming down, plenty of room, plenty of room, plenty of room. And here you have some bony overgrowth from arthritis, and it's pinching on the area of the spinal cord. And this you'll see in a second what it looks like. See, it starts to pinch here. This is normal. You have plenty of space around the spinal canal, spinal cord. There's the fluid. But then here you get this bony overgrowth, and it starts to pinch. And as the nerve roots try and come off of the spinal cord, get out, they get pinched, and that's where the symptoms come from. So what are the symptoms? Well, typically, individual will have an aching pain in the buttock, into the leg, the thigh, on the affected side. It might be both sides. They may have symptoms of sciatica, and in unusual cases, they may have some leg weakness, some numbness, pins and needles sensation. In some cases, it may be mistaken for a hip joint problem. So you might have pain that seemingly comes from hip arthritis, but in actuality, it may just be referred pain from a lumbar spinal stenosis problem radiating around into the hip area. So it's usually positional related. Out of a textbook, if a patient comes, you'll see that they often say, well, I feel better when I'm leaning forward. And that might be, say, at the supermarket, where they're leaning forward on a shopping cart. And that actually opens up the diameter of the spinal canal, and the nerve roots can be unpinched, so they feel better. And that's called neurogenic claudication, when positionally the nerve roots are getting pinched. And that's very different from vascular claudication, which occurs from peripheral artery disease. So if someone says, I walk about 30 yards, I start to get cramping in my calves, and then I stop and it feels better, that's usually vascular. It's not spinal stenosis. Spinal stenosis, they usually say, I get some cramping in my buttock and my thigh, and if I lean forward, it typically goes away. That's more neurogenic claudication. Most people with spinal stenosis have no symptoms at all, actually. Treatment options for symptomatic stenosis should be, first of all, very simple: over-the-counter nonsteroidals and Tylenol. Make sure you take those according to manufacturer's recommended dosing. There's also some literature, such as this study out of Spine from 2007, showing that medications like Neurontin and Lyrica can actually work very well for the symptoms of spinal stenosis. For short-term exacerbation periods, prescription pain medication can be helpful. Over the long term, these are a terrible idea, as they can cause tolerance and addiction. Physical therapy and chiropractic treatment can be extremely helpful to help unpinch nerve roots. Spinal decompression therapy is a revolutionary treatment that has been FDA cleared, and over the last decade, it's increased in popularity exponentially, and that can give months of pain relief. It's non-invasive, there's really minimal risks. And then you have epidural steroid injections, which are the gold standard for spinal stenosis. And here on the right, you can see a picture of a caudal epidural. So here's the lumbar spine, and here's the sacrum, and this is an opening called the sacral hiatus. Steroid injection is administered through the hiatus, and it can actually bathe the pinched nerve roots at multiple locations, providing pain relief. So whether or not to have surgery for spinal stenosis is always a quality of life decision. It is not imperative that you do that. The decision should only be made after considerable conservative treatments fail. Lumbar laminectomy is the procedure, and here's what happens: is the bone from behind the spinal canal is removed. So here you can see the nerve roots on the right and left being freed up. Okay, it's a general anesthesia procedure. It takes about an hour. Typically, it does not need a spinal fusion. Low risks, but it is surgery. So 50% do end up with some back stiffness postoperatively, and there's always a chance of post-laminectomy syndrome, which is basically you have these nerve roots that get freed up in surgery. If scar tissue comes back in around these nerve roots, you can end up with pain that radiates down the leg from that, and that's really not curable. So the bottom line with stenosis is that surgery can be avoided over 90% of the time, Epidural injections are usually given as a series, so a series of 3 every couple of weeks for 6 weeks, and then you can repeat that every few months for pain relief. And it is, once again, a quality of life decision as to whether or not to have surgery. And when you add a spinal fusion to a stenosis procedure for laminectomy, it's a whole new level of complexity, complication potential, so you should think twice about agreeing to having a fusion with your laminectomy. The Nevada Pain Network has numerous board-certified and award-winning pain management doctors, chiropractors, and physical rehab providers. Multiple locations accepting over 50 insurances, providing both medical and interventional pain management. One number to call for scheduling at 702-323-0553, and visit us on the web at painmanagementlasvegas.com. I'm Dr. David Green with the Nevada Pain Network. Your pain stops here.